And I'd like to welcome everybody to our first seminar of the Fall 2025 seminar series. And we are the Oregon Institute of Occupational Health Sciences at Oregon Health and Science University. And it's my pleasure to be able to introduce our speakers today, our presenters. We are very pleased to have Dr. Emily Huang, who is going to be presenting along with Dr. Frank Giordana. And what I'd like to do is just start with a little bit of an overview, and then I'm going to turn it over to Emily and Frank, and then I will make sure that we have a few minutes at the end for any questions. But if there is a burning question during the presentation, you can put it into the chat if you are able, and I will be monitoring the chat. So Dr. Emily Huang is a professor here at the Oregon Institute of Occupational Health Sciences at OHSU, and she's an associate director of the Oregon Healthy Workforce Center, one of the 10 total worker health centers of excellence funded by NIOSH. She is an occupational health psychologist and an industrial organizational psychologist with over 30 years of experience in research and practice. And her work centers on developing and validating surveys such as the Safety Climate, Total Worker Health Climate, and Respectful Workplace Climate surveys to assess workplace culture and guide organizational interventions. She also designs trainings to help organizations enhance their workplace culture and employee well-being. And we will be hearing about her specific Total Worker Health Climate survey and training today. And then her partner in this work is Dr. Frank Giordano, and he's a project manager at the Safety Climate Lab, who has been working with Emily for some time and part of the Oregon Institute of Occupational Health Sciences at OHSU. He holds a PhD in industrial organizational psychology from Kansas State University, and his research focuses on occupational safety and health, risk perception, and work arrangements, with an emphasis on translating evidence into actionable interventions that improve workplace safety, health, and overall employee well-being. So thank you very much, Emily and Frank, for being willing to be our first presenters this fall. And I'm going to ask that everybody please mute your mics, and again, feel free to put any questions in the chat if you would like, or we will have time at the end of the presentation. So, Emily, I'm turning it over to you.
Yeah, thank you, Leslie. Yeah, appreciate it. Hi, everyone. I'm Emily. Thank you for joining us today. And today we are very delighted to have a chance to share our project with you, titled Building Total Worker Health Culture, from Total Worker Health Climate Survey to Cultural Training. We have a Safety Climate Lab at our institute, and the mission of our lab is to help organizations build a good workplace culture and climate, and help to improve employees' safety, health, and well-being. We have a core team, and we also have support from many colleagues. Many colleagues support our team, and we really appreciate their support and contributions. And before I joined the Institute, I've been working in the safety field for over 20 years. So I'm very happy to share this project with you, which also extend from the prior safety research and extend it to the field of total worker health. We all know that even today, occupational injury is still a great concern in the workplace. As we see from this data here, even today, there are still over 2 million of workplace injury happen every year. Over 5,000 people die at work, fatality injury. And we know when those injuries happen, it's not only impact on the employee themselves, impact on their family, they cost company monies too. From this Liberty Mutual Workplace Safety Index, you can see that from the total cost of most disabling workplace injuries is nearly 60 billion, 58.61 billion a year. That means over $1 billion a week. Again, when injury happen, that impact on people, quality of their life, their families, the community, and also it costs a lot of money as well. According to this accident report about a workplace disaster, you can see that poor safety culture has been identified as one of the key factors contribute to those workplace injury. And safety climate and safety culture has been identified as one of the key factors, as we mentioned. And what does that mean? So what does it? Yeah, what's the definition? What's the mean? What does it mean? So safety culture has been typically defined is about employees, the company's underlying belief, how things work, and the core values, whether companies really care about safety, whether it's a core value for the companies, and that also interact with the company structure, their system, to produce the behavior norms of their employee. Again, safety culture has been defined as the underlying belief of the company, the core value, whether it's really important for their company, and that interact together to impact on employees and build the behavior norms. So you can see the concept is very conceptual. How can we measure a safety culture about the core values, about the behavior norms? It's very conceptual. It's very hard to measure. So safety climate has been defined as the measurable aspect of safety cultures. It's an indicator of the safety culture of the workplace. And the definition of safety climates, it has been first introduced by Professor Dov Zoha back in 1980, published the first articles in the Journal of Applied Psychology, the #1 journal in our field. And safety climate is defined as employees' shared perception of their company's safety policies, procedures, and practices. So it's a shared perception, it's a company-wide perception, and based on employee score. Based on employees seeing through their eyes whether company have good policy, procedure, and practices. It's about the overall importance and the true or the relative priority of safety at work. It's not just about what you say, it's about what company do to demonstrate, to show safety is really a true priority. Again, you can see that a lot of companies say safety is #1. When you walk in their factory, in their company, they say safety is #1. There's a big sign. But sometimes you see when there's a competing demands, it costs time. The company doesn't have time, and then or when the money is needed, then safety is no longer important. So you can see when we measure the safety culture company, it's really important to identify what is the true or the relative priority of safety for that company at work. It's probably not a surprise to you, the #1 dimension of safety culture and safety climate is the management commitment to safety and prioritize safety over other competing demands across a range of situations, time, monies, resources needed. And again, it's not about what you say, it's about what you do. And compared to some approach like behavior-based approach, they focus on bottom-up. Safety culture climate started from top-down, the management commitment to safety, all the way from top managers, middle managers, to frontline supervisor, all the way to employees themselves. Everybody should contribute, but all the way from top-down. And again, management commitment is the #1 dimension of safety culture and safety climate research. Safety climate research has grown a lot. Why? As you can see that Dr. Zoha published the first paper back in 1980. His paper has been cited nearly 5,000 times. And I kind of used the Google Scholar to check how many papers has been identified relevant or in the field of safety climate. Actually, it's not even safety culture, just safety climate. And I find there are over 4 million articles identified by Google Scholar a couple days ago when I checked Google Scholar. Why is it important? Because safety climate has been identified as one of the best leading indicator for future accidents and injuries. Accident and injuries are lagging indicators. A lot of companies do accident analysis, especially when disaster happen, when fatalities happen. We know it's important, Again, it is a lagging indicator, and company doesn't have to wait until disaster accident happen to know their place is not safe. You can use a leading indicator, such as the safety climate, as an indicator for the workplace safety. From this article, it has been identified when the company have a good safety culture, which reflect on the safety climate surveys, their employees have better safety knowledge, they are more motivated to contribute and committed to safety, that also lead to better safety behavior, safety performance, all the way linked to workplace accident and injuries. I've been working in the field for over 20 years now, and in this paper, we are happy to show the impact of safety culture, safety climate are beyond safety outcomes. Like in this paper, we are happy to share when the company committed to safety, their employee have higher level of job satisfaction, higher level of employee engagement. We also collect objective data, and we have shown that we have demonstrated that when a company care about safety, have a good culture and climate, their objective turnover rate are lower as well. Again, these data collected from trucking industries that apply to other industry as well. For some industry, again, the turnover rate is so high. Again, I know when I work those companies, they are so appreciated to see and then to demonstrate and show that when company care about safety, the impact is beyond safety outcome. I'm very honored and very fortunate to have worked with Dr. Dov Zoha back in 2009, and our team have developed multiple safety climate scales while he joined us as a visiting scholar. And we also utilize his scale developed back in 2005, which has been utilized a lot in the industry and the scientific communities. Like his scale have total of 32 items, 16 items to measure company level safety cultures, and 16 items to measure supervisor level, the local safety culture and climate. So his scale has 32 items, 16 plus 16 items. And our team have worked together. We apply item response theories, and we have reduce that 32 items to 4 plus 4. So we are happy to share it. If any company want to know whether they have good safety culture, whether they have a good safety climate score, they are welcome to use the scale which Dov and I published earlier. And then if you are welcome to utilize the full scale, that's 32 items, 16 plus 16s, or even just using 4 questions, we are able to give you a good score of the safety climate for the company levels. And again, safety climate has to be already been identified as one of the best leading indicator for future accidents and injuries. And we always say safety culture and safety climate can be monitored and measured and hence improve. What gets measured, get managed. And I really appreciate the opportunity to join our Oregon Institute of Occupational Health Science at OHSU. We have Oregon Healthy Workforce Center, one of the total worker health center funded by NIOSH. And here is the definition for total worker health. It is described as the practices that integrate both protection from work-related safety, health hazard, and promotion of injury and illness prevention effort to advance overall well-being. So after joining the Institute, that really helped me extend my work from the safety culture climate research to the total worker health, the field of total worker health, that extending from safety to health, that includes physical health, mental health, and all the way to focus on the well-being, the big pictures, the system approach. Yes. So in these projects, we are very happy to share with you today. We extend our work from safety culture, safety climate to the total worker health, culture and climate. And we also extend from our prior work from developed safety climate surveys to develop total worker health climate survey. And our Oregon Healthy Workforce Centers are focused on providing training interventions. That's our expertise. We have experts in our centers who has been working on providing trainings, intervention to improve workplace safety, health, and well-being for many years. So we appreciate, we have learned a lot. So our lab has been extending from our scale development to also develop and validate, and with the goal to help companies to improve their total worker health cultures. So in this project today, we would like to share with you from how we developed the total worker health climate scale, both the full scale and the short scales, again, based on the safety climate research, and also how we extended to develop 3 levels of total worker health cultural training that apply to 3 different levels. The first one will be for the general trainings. We encourage everybody to take it from frontline employee all the way to the CEO to top managers. We also have a second component focused on supervisors for the local cultures of the company, and also coupled with the behavior trackings to encourage supervisors to practice what they learn from the training, and also the top management education and feedback workshop. Again, manager are the number 1 components of creating a good culture and climate for the company. In terms of developing survey, as I just shared with you, we appreciate we have been extending our scope from safety climate research to include total worker health, extended to the field of total worker health. That includes 3 dimensions. The first is the climate for safety. That's based on Dr. Zoha's research. And again, and also what we have been working together, how we apply the best approach to develop all the safety climate surveys, extended to develop additional 2 components. The climate for the physical health, that focus on diet, exercise, sleep. And the third component is climate for mental well-being, extended from safety to physical health, all the way to mental health, mental well-being, including psychological, emotional, social health, and overall life satisfaction. And we define total worker health climate as the employees' shared perception of their company's policy, procedure, and practices as they pertain to the value of their safety, health, and well-being, and the overall importance and the true and the relative priority of total worker health at work. Again, the number 1 dimension of a good total worker health culture and total worker health climate is the management commitment. And company prioritize total worker health over competing demands across a range of situations. And the theories, reasoning behind we build this scale, again, extending from the safety climate research. Extending from these 40 years of research, we apply that with the goal to develop a climate scale capable of measuring safety, health, well-being, and also the total worker health cultures as a whole, as a whole construct, an overarching factor above the 3 sub-dimensions. And we follow the best scientific practices in combining both qualitative and quantitative approach when we develop the scales, that including starting from the literature review. We have an expert panel join us, develop questions. We conduct structured interviews. After question generalize it, we conduct cognitive interviews, make sure the question is clear to read. We apply the 7th grade level reading levels. We're doing our best to make sure the question is really measure the content and also are clear to the people to able to take it. And then we also invite the whole panel to help us along the way to develop the scales. In terms of the quantitative pieces, we have collect data from multiple sources, including panels. We apply that with utility companies, with manufacturing company, and utilizing all the data and apply statistics to show different type of reliability and validities, the content, the construct, the criterion related validities. And we are very happy to share, like in terms of criterion validity, whether a company get a score, really link it to the outcomes they care. And we apply the multi-level analysis. We are happy to share that regardless whether it's individual level outcomes, the group level outcome, or the company level outcomes, our total worker health climate score link it to all these important outcomes. And the sub-dimension, the safety climate, link it to safety outcome, physical health climate score, link it to physical health outcomes, the mental health, link it to mental health outcomes. On top of that, the overall total worker health climate, the overarching factors also predict important outcomes across all dimensions as well, which means if companies, they are interested to see their total worker health, they are welcome to take the survey, include all 3 levels. If they are only interested about mental health well-being, mental health climate, they are welcome to use the subscale as well. And we are happy to share, we demonstrate the link and different type of reliability and validity to show the evidence the scale are really measuring the total worker health culture. And we are very happy to share the paper will be published in Journal of Occupational Health Psychology very shortly. We just submit the final proof. So look forward to share that with the communities. So the full total worker health climate scale have 40 items that include the 16 items from the safety climate. They have been developed by Dr. Zoha, have been utilized a lot in the past. And also 14 questions for the physical health climate and 10 items to measure mental well-being climate. So if a company like to use the 4 scales to measure and identify where's the room for improvement, what are their strengths, utilize it to us like a 4 scale to identify their strengths and weaknesses, they are very welcome to use the 4 scale, which has 40 items. And we also continue to enhance the items by shortening the scale using item response series, as we shared with you earlier from the safety climate research. And we are happy to say a company can utilize the 15 questions as well to measure their total worker health. That's the 4 questions to measure the safety climate, 6 questions to measure the physical health climate, and 5 items to measure the mental well-being climate. And we are in the final stage into submitting the manuscripts, and we look forward to share both the full scale and the short scales with both the scientific community and the practical communities. And we're hoping company can utilize to help them to improve their safety culture, and yes, their safety culture, total worker health culture, and extend it to physical and mental health, mental well-being culture as well. Current progress. Again, we are very happy to have the opportunity to extend our work from safety culture, safety climate research to total worker health, culture and climate. And we are happy to say we are completed developing the scale, looking forward to share the scale items with the community. And we also have opportunities to develop 3 different type of trainings, and then to share, to extend it, including extending from safety to total worker health. We have developed and tested the general foundation trainings applied to all employees, to everybody, the supervisor trainings. And in terms of top management feedback workshop, since working with Professor Zoha, we have been offering and providing the feedback workshop education section to top management to over 100 companies. So again, we appreciate the opportunities to extending from the safety to total worker health, from scale development to offer trainings to the community. And now I would like to invite our, hand it over and invite Dr. Frank Giordano, our project manager, to provide us more detail about those trainings.
Thank you, Emily. So like you mentioned, I am the project manager for the Total Worker Health Culture Survey validation and the training development projects. So I can speak to some of these details that we've undergone quite a few times now. And simultaneously to both of these projects, we were also developing training based on our prior safety climate scale work as well. So we had the opportunity for some trial and error before getting to the total worker health culture and climate training. So what we have here is a culmination of our efforts as we tied together what we've learned for the general training that is intended for all employees, the supervisor training coupled with the behavioral tracking for those with managerial responsibilities, and our traditional top management feedback workshops that we've done through our normal safety, culture, and climate consulting. So our goal is to eventually have all three of these levels ready to go as a total training intervention package. But as you can see, we designed it in such a way that we could have some flexibility beyond that as well. So we go to the next slide, please. We learned 4 lessons, I think quite specifically, while both validating the total worker health culture and climate survey with all the nuance that comes with total worker health as a concept and the development of our safety climate training as well. So the first thing that we noticed was that there was a lot of support both internally from our colleagues and SMEs, but also externally from participants and participating organizations' leadership for the scale. So certain light bulbs would go off when we would mention an item or a subdimension or bring up total worker health principles that would often get people excited. So we would feel like we were striking a nerve or getting to the core of what people want to know or feel about their organizations. So in many cases, we would work backwards from key items and concepts and parts of our preamble explaining what total worker health is, and work backwards from there to generate the content for pieces that people thought were interesting or necessary to share. Second, thanks to our validation processes having a lot of qualitative components, we had the Hinkett and Tracy content validation approach, we had the iterative Delphi method, we had cognitive interviews with SMEs, and then structured interviews with job incumbents. We're able to probe a lot of the excitement that we were getting and find some nuggets of information or specific content that were particularly useful to making people understand what total worker health and what total worker health culture was as a main point, or something that could hook someone to care about total worker health, or portions of total worker health that felt more real. So from there, we were able to poke and prod and turn something that's pretty high level in terms of being conceptual into something more concrete. So total worker health itself, with all of its concepts of integration in which safety, physical health, and mental well-being are greater put together than just the simple sum of their parts, and how integration is a very specific term, and there's promotion and prevention aspects. We were able to chip away at what was difficult to understand and what was a bit more real to make these things feel like they had impact on actual outcomes and were related to behaviors that people could actually engage in. So this is something we're able to find and see what resonated with certain people and use that as an opportunity to gain feedback on what we should be actually putting to make the content feel grounded. Third, we recognize that we needed to tailor the content for different audiences to truly have that organizational wide approach. We want to appeal to frontline workers as much as people with managerial positions sitting in an office. While everyone has the capability to contribute to their culture and their immediate surroundings, different people have varying effects on their organization's culture and climate, and they can do this with different behaviors and actions as well. So this led us to make the decision that we needed to have these multiple levels and multiple trainings for each audience, which allows us to train and service everyone that's interested to take it, not just those that companies felt like had to take it. And finally, we recognize that what separates us from a traditional training is our systemic focus. Culture and climate by nature are systemic, and thus we can use that to drive lasting change. When we would bring this up, we would generate some excitement and interest on how that change can actually come to fruition from that systems perspective. And we wanted to use that as an opportunity to display how that can happen and what that looks like in practice. So next slide, please. So we had a lot of interesting tailored feedback to teach us those lessons, but there's also some general best practices we were really keen on maintaining for the development and evaluation of our training, with some specifics in mind. The first was that teaching declarative and procedural knowledge is important to show people what they need to do and how to do it, but also they need to feel good about it, meaning we needed to gear our content and have measurement for cognitive, skill-based, and effective outcomes altogether. We also needed to test for these knowledge gains, but at the same time, promote the use of that knowledge on a daily basis to really get to that transfer of the training. We want the people to use that knowledge as regularly as possible whenever it's applicable, not just be able to do well in a pre and post test. So specifically, we aim to do that with the behavioral tracking. And when that was not feasible, we did our best to have interactive components in our training that would get somewhere close to being more like an actual practice scenario. We also wanted to establish that having a shared mental model is key for training people in groups. To maintain that systemic and multi-level focus, we need to teach people to engage in certain behaviors, but also recognize that their behaviors are not in a vacuum. They'll play off each other and generate an environment that that culture can thrive in. So by prioritizing having a shared mental model and teaching people the same language, the same words to use, the same jargon, we can really establish what the work priorities are and how everyone can contribute uniquely to the maintenance of a strong organizational culture. And our final goal was to have sufficient room for feedback. Traditional consulting that we have done in the past would always incorporate that feedback workshop to top managers, but now we have multiple points to share feedback, either in the pre and post test, in the traditional feedback workshop, in the behavioral tracking, through additional top management meetings. And all of this is areas where we can test for that growth and then give feedback based on that growth. Next slide. And like our survey validation process, we engage in this iterative method of perusing literature, developing materials, then contacting SMEs, gathering as much feedback as we could, and then revise that until we were comfortable with implementation. So first, we developed training modules to assess some learning objectives that I'll review in a bit. And our goal was to help people understand what total worker health was and how an organizational culture can be surrounded around total worker health. And then we would share what they can do to promote it regardless of their position in a company, as well as based on what they can do in the position of their company, having that hierarchy in mind. We also created guide documentation such as one-pagers, behavioral tracking documents, assessment materials to facilitate training, things like that. And then we ran these materials by SMEs and job incumbents with that similar process of having something to validate it through content validation, having the iterative Delphi process, and then interviews with people explicitly to work out any kinks, make sure our language is fine, ensuring that we have got some readability and knowability, and then we would begin our actual implementation. So next slide, please. And from our own experience from our traditional safety climate feedback workshops, we wanted our approach to be modular. So this is pretty common to parse things out into modules, but we did this in a way that offers us some unique freedom as we continue to develop or make any changes. First, we thought this would really help breaking up the monotony while giving room for individuals to be self-paced. Workers that would benefit most from training like this are often not sitting down in classroom scenarios. They're not sitting down watching slideshow presentations. So we can do our best to be engaging within the confines of the software with engaging content, but also we wanted to offer breathing room to simply walk away from the software as needed. We also have the capability of doing this with a mixed design, either being all in person, all remote, or half and half. And we thought having the modules would give us the freedom to do that effectively. This also helps us present whole ideas in a nice, neat package and avoid any information overload. This gives a room for us to sneak in attention checks between the modules, additional activities, and let people collect themselves before moving on from relatively hefty concepts. And finally, this allowed us to mix and match as needed. So our goal is to inevitably have this general training that can go to all employees, followed by subsequent additional training for supervisors, then have a block of behavioral tracking, and then give feedback to the organization. But we recognize that this could be daunting and it's a bit hefty. It requires a lot of investment and time. So we understand that the training is only going to be as good as its ability to be disseminated and implemented. And by having these checkpoints, by having things split into modules, we can cater to training to whichever level is necessary based on whatever target population is needed, that needs the training based on the organization. So if the full training is a bit too much, we can target just on the supervisors. If we want the full training to happen and then just have the supervisor an additional part, we can take 1 or 2 modules from the supervisor training and tack it on to the general training. Whichever method seems to be best, we can have that. We have not tested that yet, but we have the capability to mix and match and build as needed once everything is fully validated, and we have the opportunity to go from front to back on our intervention package. Next slide, please. I think we missed a slide. Can you go back one, Emily? Perfect. So for the actual materials, we aim to have these 4 main training objectives packaged into those modules. So first is establishing the importance of the facet. In this case, the facet would be total worker health, including all of its pieces, which would be safety, health, and well-being, and how they integrate together. So people need to know what total worker health is, need to understand that it's an important part of their work environment, and understand what goes into maintaining total worker health. We start this with talking about safety and then safety culture. We use that safety as the foot in the door. It's not too conceptual. People are already aware about it. They understand it. And then we use that to segue into long-term physical health being a very important component, as well as mental well-being, both at work and the home being important, so they can understand the importance of total worker health as the main facet of the culture and climate. Then we introduce what makes our training particularly unique, which is the organizational culture and climate etiology, or specifically what culture is and how it is felt. I'll talk more about that in a moment. Once we've established the facet, it could have a culture surrounded by it, and then specifically how culture operates. Then we can start talking about how to deliver on the maintenance and improvement of that culture with specific behaviors. We share what those behaviors are and why they work. And then ultimately, we demonstrate those behaviors. We have role modeling scenarios within the training. We have exercises to engage while on the job to remind you to be attentive to these things. We have select questions to pose to yourself throughout the day to make sure that total worker health is being promoted and people are being protected. And then ultimately, we have the behavioral tracking specifically for the supervisors. Next slide. So the first module is pretty straightforward. It's where we establish total worker health as the facet and as the base for culture. So we combine the best practices for engaging in total worker health for yourself, as well as for those around you. And then we use that as the basis to introduce the concept of culture as prioritizing total worker health and those best practices that we just shared. So we start with the explanation of safety, which is pretty easy to understand. You can keep yourself safe by following certain procedures. And then if everyone is doing that together in concert, you create an environment where that's a key priority. Then we use that kind of model to explain how it's applied to health and well-being. And then in combination, that's what total worker health can be. Next slide, please. Then to promote that shared mental model, that climate strength of people all understanding the same jargon and words surrounding culture, we focus on sharing the etiology. We become more specific about culture itself, how their organization can promote total worker health culture, and how individuals can promote total worker health culture by advancing culture specifically, not just behaviors that improve their total worker health, their safety, health, and well-being. This is where we make it clear that promoting your own safety, health, and well-being is distinct from promoting total worker health culture, despite having significant overlap. So not in so many words, we share the main methods in which culture is felt and defined through this etiology, with environment being not just the physical space, but also the general milieu of where people engage in work. People, which includes coworkers, managers, supervisors. Symbolic interaction, which are actions that display what an organization prioritizes. This includes hiring, firing, promoting, policy changes, allocation of resources, things of that sort, and leadership. So leadership in this instance, we want to be clear that there's local leadership and organizational leadership, and leaders have a unique level of accountability over the culture that they share. All workers can hold leaders accountable, despite leaders having that unique ability to shape culture and climate, and workers still have agency over their immediate culture, climate, and their own individual total worker health. So we wanted to be very explicit that while there is unique responsibility from leadership, individuals still have the power to do something for themselves and for the culture that they are immediately surrounding in. Next slide. And then our final and third module. So we've had success with acronyms in the past. So our last module is that procedural knowledge section packaged with a short saying that we try to keep stick. We've had a lot of positive feedback when breaking down these behavioral expectations in this way, having something catchy, an earworm, an acronym. So we decided to do it in this way, and we dedicate time to explain what we mean by each initial of that acronym and pair it with a set of behaviors. Then we pair those behaviors with scenarios or a checklist or questions to ask yourself when it pertains to maintaining the standard of behavior necessary to uphold that part of the acronym. So for general training, we use LEAD with listen, examine, act, and deliver, where listening is using your ears to understand the expectations of work for the day. Examine is to use your eyes to determine what the day's work is set up for, if it's set up for success, as well as protecting total worker health. Act is to use your hands and actually engage in that day's work, or to engage in correcting issues that would block the promotion of total worker health. And the D would be deliver, to start communicating and provide feedback to recognize when good total worker health culture is being promoted and speak up when it isn't, to go through the proper channels to report that and find out if there's a way you can act upon correcting those issues that you're noticing. For supervisors, we have supervisors review the ABCDs of total worker health leadership with attention, boundaries, communication, and design. Attention is giving care to the employee individually as well as in groups on the whole. Behaviors is to be respectful of certain issues that can be delicate while still doing your due diligence to ensure that workers are being protected. Communication is to both deliver expectations clearly, but to also actively listen to your employees. And the design is to alter the state of work as needed to promote total worker health, as supervisors will have that decision latitude to engage in work design or redesign as needed. And this was designed to be an expansion on that lead section. So there's not a whole lot of overlap or redundancy for the supervisors when they get to their new additional set of behaviors that they need to engage in when they see their own unique module 3 for the supervisor level. And next slide.
Okay, sorry.
No problem. After passing these modules through the hands of a few SMEs, we started to test these trainings. As we were working on the total worker health general training, we were already able to disseminate the safety trainings that we had. So the safety climate general training was on a job site directly with tablets. We were able to implement that as well as conduct our post-training feedback sessions in just about 2 hours of the actual incumbent's time. We had to go and set up and then break down, but people were there, they did the training and gave us feedback in a 2-hour span. We did the same for the supervisor safety climate training, but we did that in the company's general office in their meeting room. So we went somewhere, we brought the tablets, and took a similar amount of time, 2 hours, to introduce the training from start to finish, and then do our traditional feedback where we try to gather as much information as we can to improve it. For the total worker health general training, we did that online entirely, and that was through our software and worked quite well. And then for the supervisor training, we actually did a mixed design. We had a few people that were not able to come to the time slot that we had available to do that, but were still interested in taking the training. And we're able to disseminate all of our materials to them online remotely, which was really helpful. So at this point, we're comfortable either way, doing it on the actual job site, doing that in fully remote or something in between, whichever is preferred. Modality is really not an issue for us at this point. Next slide.
So we probably,
So here are some.
we probably have
Was that Emily?
5 minutes. Yeah. Sorry.
Okay, this is my last slide. Here are some details regarding our training assessment. So just under an hour to complete the general training, which is all 3 modules. The first 2 modules are a little bit faster than the last module because we always try to balance having more information on that procedural knowledge section. We only took 35 minutes for the supervisor training, which makes sense. We're intending to have this be back to back, at least in a couple of weeks, so no need to be redundant. Modules 1 and 2 were largely just refreshers with targeted information for supervisors and supervisory roles, with most of the time being spent on that module 3. As for means in the pre-test and post-test, we see improvement, which is great. And we have a higher mean for the general training because it was intended to be a bit easier. We were a bit more difficult for the supervisors. As for the effect sizes, we have moderate to pretty strong Cohen's D's from the general training to the supervisor training. And we got a lot of positive feedback about the content. Most of the feedback that we received was more about modality, bells and whistle preferences, who likes AI voices, who doesn't like AI voices, things to that effect. But comments about the actual content were all pretty strong, represented by that high feedback score, which is out of 5. And then the next slide, we have some testimonials that encapsulate a lot of those positive feedback that we got from individuals. Specifically, we have one line that we thought someone was telling us specifically, which is our goal we're trying to achieve, is that they wish everyone had a chance to take a training like this because it helped them better understand how to take care of their team members as well as themselves, which is exactly what we're trying to accomplish, where we want to teach people about total worker health and how to protect their total worker health, but at the same time promote that culture and having that strong environment. So we were really elated to get this exact message from somebody. So we were very, very happy with the feedback that we received.
Yeah, thank you, Frank. Appreciate it. Again, our team, we're very, very delighted to have a chance to share with you our work all the way from safety culture climate to total worker health culture climate scale development and trainings. And for the future plan, we'll continue. And also we have extended our work from safety to total worker health and also extend to the respectful workplace culture and climate. So we'll continue work on those different topic, different focus, and we appreciate the opportunity to extend it to safety to health, to respectful workplace. And we also we'll apply that approach for the multi-level trainings from frontline employees, from top managers, from employees, all the way, the 3 level of trainings for all 3 type of cultural climate training. And we also like to expand our work to reach different industries and also leveraging from what we learned across different sectors and also apply that to different regions from in Oregon's across the industries and in different regions of the world. Yeah, thank you again for inviting us to join this seminar.
Wonderful. Thank you so much, Emily and Frank. Really appreciate your presentation, and it clearly shows the journey and really the as you said, the extension from all of the work you did on safety, climate measurement and training to the total worker health climate measurement and training. So it's fascinating, and I think having it all together in this package, this is, I think, the first time that we've kind of seen different bits and pieces, but Frank's piece really then got into some of the details of the training. It was very helpful from my perspective. There are a few questions in the chat, and I also want to encourage folks to also feel free to unmute and ask questions. But I'm going to go ahead and just repeat the first question, which came from Matt. And this question is, and actually I had the same question in a sense. Matt says a short scale can be great because it's more easily adopted, but what information do you lose from the long scale? when would you recommend long versus short for the total worker health climate? And I was wondering the same thing because, as somebody who developed a longer scale of FSSB and then a short scale of FSSB, I really don't think that the long scale is used at all. I think most people are going with the short scale. So I guess what are the advantages of of the long scale versus the short scale or the short scale? I mean, we know the advantages of a short scale over a long scale, but once you validate the short scale, why would somebody use the long scale?
Yes, yeah, thank you for the questions, and thank you, Matt. Again, the scales, the regular long scale are more comprehensive. So since working with Dove, we have utilized that to provide detailed feedback back to the company. Like the ZOHA scale have 16 questions. In the workshop, we always identify what are the top 3 items have the highest score, which show you are doing great. Your company, not necessarily the best, not necessarily really high, but that's the best 3 items in your company, which you should continue to do what you're doing. And the 3 items with a lower score that really identify where's the room for improvement. What are the 3 key factors, for examples, you should really target on in order to improve your cultural climate. So again, the regular scale are more diagnostic, but definitely it's not comprehensive because the scale is a leading indicator, predict outcomes. However, from the regular set of questions, definitely provide more detailed information, where to change, what can you do to improve your companies. So, and then after that, we would suggest after you are more clear about what's your safety cultural climate look like, where's the room for improvement, where's your strengths and weaknesses. Then after that, maybe a year later, after you implement trainings, implement a package, then you maybe choose that 4 questions. The 4 questions, you can get a validated score, reliable score to show whether your package, your training really make impact. Your score changed from 3 to 4. And in that case, you already know your strengths and weaknesses. You don't need that much detailed information where you want to change. So again, if a company directly say, again, I really don't care about where is our key strengths and weaknesses. I just want to know, give me a score right now. Tell me how great we are. We know, like in safety climate score 1 to 5, a company score below 3 means they are in critical stage. They better do something now. Don't wait until accident happen. So they say, I just want to know our score. Our score is 2.8. Okay, we better do something, but I don't care. Where's our weaknesses? Go ahead, please. You use these 4 items. However, the long scale will tell you where's the room for improvements, where you should focus on. Yeah,
so that I just make a comment that's really helpful because and I haven't read the JOHP yet, but I hope in there that there is that description of why this scale is why the long scale is important, because it can be used diagnostically. I mean, that makes complete sense. So in terms of construct validation, they're probably similar in terms of construct validation. They're both measuring total worker health, but the longer scale, and that which is different than the difference between my long and short FSSB scale. We haven't actually used it in that way. So that's really, really helpful. Great.
We do publish a paper in 2017 about why we decided to develop a short safety climate scale on top of the long scale. So we do explain that specifically in the paper already. Yes. Be happy to share that. Yeah, thank you, Matt. Yeah, thank you, Leslie.
Great. I think that I had 2 other questions, but from me, but they were actually both answered in the presentation by Frank. So I'd like to open it up for others who may have questions or comments. Steve.
Yes, thanks, Emily and Frank. Great presentation. I may have missed it, but I was sort of wondering if there were examples of behavior tracking that you implemented.
We didn't provide that there, but actually Leslie and Ryan are our expert in behavior tracking. That's where we learn. So based on our training, our total worker health culture training components, we will target on what kind of behaviors we like to encourage supervisors to do. Then we prepare the list, not checklist, a behavior tracking list and offer that. And actually that's we learn from Leslie and Ryan. We have there are multiple examples or how that have been utilized. Yes, and Ryan has been our one of our key personnel, and that's how we learn that.
Okay, but can you give me an example of what one might be? What behavior would you be tracking, for instance?
And Frank,
I can go off the top of my head. I'm searching for it now, but I have a new computer. But we would explain one of they were on flashcards. So someone would have one of the acronyms be indicated at the top. So we could say examine, for instance.
Yeah.
And during examine, we would explain, you need to go and do a walk around. You need to go and make sure everyone has their PPE. You need to go and have a checklist of things to do that were described as to how to do the examine part of the
Mhm.
acronym properly. Then underneath, we would have descriptions of those short little things that we provided, along with the questions that we would say that you should ask yourself every day. Did I make sure that my workers are protected at this job site for XYZ problem?
Sure.
Then we would have a frequency chart where they would list how often they engaged in that behavior that day, how satisfied they were with the quality of the behaviors they were enacting. Some of these things are things you only do once or twice a day. You don't have to do a walk around every 15 minutes. But you should have you should have your eyes peeled, you should be diligent, you should be doing it to a certain degree to make sure everyone's safe. So they could say, I did this 3 times today, and I'm very happy that I did it
Yeah.
these 3 times. I thought the quality was high. And then they had a section for notes as well. So it's an internal system of making sure people are thinking about it over the course of the 2 weeks that they're asked to do it, as opposed to something that's a bit more absolute. They are deciding their own pace and are grading themselves on how well they think they're enacting on those behaviors.
Thank you. Oh, Steve,
Yeah.
there's one more question I wanted to make sure we had time to address, but did you have a follow-up question, Steve?
Yeah, thank you.
Okay. And then there's a question from Katya. Do you see the training as a standalone without the scale or not? If so, how do you think that can be done?
in the development stage, of course, we would love to really able to implement the whole 3 levels in companies to validate it first. And after we validate it, that we include different level of the evidence, right? Each training independently can see the pre-post test knowledge change, and the overall package have the climate score change. So after the validation stage, then we are hoping we can really implement it in multiple years research project. Then we'd be happy to offer that training individually after we demonstrate both the overall package, the improvement, and the individual components, plus the changes, the D effect size for both the overall and individuals. At that time, we'll be happy to share that. Again, in the future, we be happy to, we will target on and happy to offer the training as a standalone. But it probably takes several years after we really have
But what
the
if an organization wanted to
Mhm.
tomorrow wants to implement the training? Are you going to say no?
That would be consulting purposes, right? So we would again, we are from a research institute. We would love to see what's the way similar to the climate scales, right? The different, yes, how do we want to offer our training package, and then how confident we are in terms of we are offering something scientific validated as we are researchers in the field. But yes, we would love to see what we can do, but maybe we will say it has been tested, highly tested, but it's not like whole comprehensive evaluate. But that would be our decisions, and I do appreciate to see if company are interested to do that soon. Yes, of course.
The biggest disadvantage is not having the growth statistic. We like when people take the survey because we can see the growth. So
Sure.
if they forego that, that's fine, and we're capable of doing that. But I like when they take the survey. We get to see the number get bigger. It's fun.
So I want to thank you both very much for taking the time to present, and I think it was quite successful. And we're off now and running with our seminar series. So I think we'll see you all next week. We have Bob Sinclair will be presenting next week, so he'll be a guest virtually as well. So thank you again, and nice seeing everybody.
Yeah, thank you for having us.
Thank you so much.
Thanks, Emily. Thanks,
Yeah,
Frank.
thank you.
Bye.
Bye-bye.
Everyone.
I can't turn it off. Oh, leave.